It's important to realize that IVF is not the only fertility treatment available. There really are a lot of other alternatives, but it really depends on what the diagnosis is for the patient and what the evaluation shows. For instance, if the female evaluation is normal and there's just a mild sperm problem, then maybe intrauterine insemination or artificial insemination, where we place the sperm directly into the uterus, could benefit the couple. If you look at the female and there's an ovulatory problem, then maybe just giving the patient some medication to help ovulation occur, which is termed ovulation induction. And then timing it with intercourse appropriately or doing the artificial insemination could benefit the patient. Sometimes we'll find that everything appears normal when we evaluate the couple. And in those instances, then typically doing ovulation induction in association with artificial insemination is appropriate and can give the patient a viable success. There are many other options as well, but again, it really depends on the patient's findings during her evaluation. For instance, there are some surgical options. There can be fibroids that can prevent pregnancy or polyps inside the uterus, and other surgical or anatomical findings that might be amenable to surgery. As an alternative, some patients need something even more than IVF. They might need donor egg IVF. For instance, the patient whose ovaries have now failed because she's 44 or older, or the patient who's young who still has ovarian failure because of chemotherapy or radiation or some kind of genetic issue. Those patients can undergo IVF using donor eggs. The uterus is still very viable and able to maintain a pregnancy. And pregnancy rates are very good for those patients. Gestational carrier IVF is another option for patients if there's a uterine issue, for instance, severe fibroids or Asherman syndrome, where the uterus has severe scarring inside the uterus, and which precludes it from carrying a pregnancy. Then a gestational carrier might be needed.